Hi, and welcome to Vital Voice. Lend us your genius and we'll give you a voice. My name is Maria Denzer, and I'll be your host for the very first edition of Vital Voice. My guest today is Jean Pavlakos. I'm super excited to have Jeannie on because she happens to be one of my favorite people on this planet. Welcome, Jeannie. She is good morning. A physical therapist, a certified canine rehab practitioner. She's been working in and as a canine rehab therapist for over 15 years and has been a physical therapist for over 35 years. And there she is. Hi, Jeannie. How you doing today?
Good morning. Nice to see you.
Same here. Well, first thing I want to do is talk about your boys. Tell me about
my boys, my Cooper boys.
Yeah.
So I have two. They're laying, actually, you can't see them. They're laying at my feet. I have two rescues, lab mixes. My Prince Charming is my tall, dark, and handsome Patton. He's 11. And my Benny, who I nicknamed Lucifer because he has the devil built in, because if there's mischief to be found, he finds it. But I love the heck out of him. But anyway, they're my life, especially during the lockdown. They were my lifesavers. They're such good company. But yes, those are my boys, my two crazy nuts.
Wonderful. Yeah. Okay, so I kind of introduced you already, but tell me anyway. Tell us about your background.
Okay.
You're a physical therapist. Just go from there.
Okay, so yeah, I graduated from the University of Connecticut, human physical therapist. Mm-hmm. That was unfortunately back in 1980. Mm-hmm. Yeah, I know. Ooh is right. So I 35 years human practice, a lot of it in orthopedics and sports medicine, but I did the whole gamut. Neurology, I did inpatient, outpatient, water therapy. I did the whole thing. And then I started at University of Tennessee in 2005 to get my CCRP. Finished in 2006 and opened my practice simultaneously in 2005 when I started my classwork, and have been practicing for the last 15 years. I actually just sold my private practice last December, and I'm now working in a specialty clinic, multi-specialty clinic here in Dayton.
Well, very nice. Okay. Now we've discussed how long you've been doing this. You've been doing this at least 15 years with the dogs, and over 35 as a human PT,
right?
And so we got your practice down, and so the other thing that you do as well is a virtual consultant for VitalVet. What do you think of the benefits of virtual consultation?
Definitely the outreach. I mean, you can affect people all over the world. I mean, there's really no geographical limitations. So, if people, a lot of times, a lot of what I do, and this is true in human medicine and canine rehab, is you're you're not only an ear, but you're a voice of consultation. So you can give people some generalities and kind of a shoulder and some suggestions to help calm them down, because people get emotional about their dogs. So, I think giving them some basic facts and some foundation so they can go to their vets with some good information, I think that's helpful.
Terrific. Okay. What kind of things can you look at, discuss, recommend in a virtual consult?
What I have found is the trickiest part is the technology. When you've got a client, if you want to look at their dog, if you want to evaluate movement, house environment, whatever, they have to be able to capture that on their camera. Unfortunately, I have seen many ceilings, many floors. I'm an expert on eyebrow shape, because oftentimes the camera where the client thinks the camera's pointed is not so. So anyway, the bottom line is it's the technology that makes it tough, really nothing else.
Okay. And what do you think is good about doing the consult, the virtual consult? What are the benefits of doing?
Well, like I said, there's a lot of information without diagnosing treatment. There's so much information, and I spend my my live appointments, literally discussing all these things that really they're more supplemental things the clients need to know. They're not necessarily treatment or diagnosing. They're just informational. And that's the part that you can do online beautifully.
Right. Okay, great.
Yeah.
Okay. And how have the pet parents responded to the virtual consult?
Wonderful. I mean, people have been so agreeable to it. COVID has made everybody's life so much more difficult. They are so appreciative their pets can even be seen. Right. And again, if if you can get the technology right and you're not, and you can kind of work through that part, then they've really been super cooperative. Most people, even the elderly who tend to have some technological deficits, will do their best to get that app on their phone and figure it all out. It may take a while, but they do it. So yeah, I think they've been wonderful. Wonderful.
For their pet, that's why. For
Yeah.
their kids, not so much.
Exactly. Yes.
So what kind of animals are you predominantly treat, and what kind of conditions?
Okay, so I'm certified as a canine rehab therapist. There is no certification for cats, but we're the closest thing you're going to get. So I've only seen like a handful of cats, which is, I equate to treating a grease pig, because they don't want to be touched. They don't want to be manipulated. They just want to shoot off in whatever direction they can go. But I also have treated a couple of rabbits, which is interesting. Yep. But their anatomy is actually quite like a dog. So with the exception of it, like their tibia is much longer, but yeah, basically their anatomy is not horribly different. So it's been fun. And I know I have colleagues that treat way other different kinds of animals, but those have been the three. But I'm primarily a dog therapist. Yeah.
Okay. And what kind of conditions do you primarily treat?
I would probably say it's kind of changed from private practice to now, but I would say I work with some fabulous surgeons now, so I see more surgeries, but orthopedics, maybe 30%, neurological patients, whether they be surgical or non-surgical, 30%, maybe geriatrics, 25, and sports patients, 20. My math is off. 20, and then sports patients, 20. I mean, it kind of depends, but and pet patients are mixed all in there.
Right. Okay.
Yeah.
Cool. What is the question that you get asked all the time by clients or potential clients?
That's easy. It's and I totally get it. How much is this going to cost? Because this is for them. I think that one, and how long is this going to take? For them, this is their hard-earned disposable dollars. This is not human insurance where it's changing now, but where it used to be, the doctor's orders it, you get it, and they don't think twice about the cost. This is a much different situation. So I've had to learn to adapt to a different mentality treating these patients.
Sure, business model. Yeah. Okay.
Yeah.
What do you find most rewarding about your work?
Oh, well, first of all, dogs are fabulous patients. So, and they don't have, they're fabulous. They are wonderful. And it's amazing what they will do for you. They don't have really a placebo. So with humans, I could probably do a jig with a magic wand and they'd go, whoa, I feel better, just because so much of it is mental, right? But dogs don't have all that emotional crap baggage. Like they don't hate their wives. They don't worry about losing their jobs. They don't have kids that are driving them crazy. They are what they are, right? So, when you treat a dog, if you do a good treatment and it's the appropriate treatment, they get better. It's very fulfilling. And you also know, though, if they don't get better, you need to change gears. So it's much more cut and dry with the dog. And so I find that very fulfilling.
Yeah, they can't lie.
Yeah, they don't lie. Exactly. And they're not lazy. They don't fake it. They either hurt or they're stressed but there's no emotion. There's really not emotion there, except fear. Fear could be involved. Yeah.
Perfect. What's a typical day look like for you? Patient typical day? Yeah,
so now it's probably a little different than it used to be, but right now every day I start with a quiet prayer, ask for help to do things well. But anyway, after that, I start with a couple of new evaluations, and then my afternoons are normally like back-to-back follow-ups. So pretty much that's how it goes. The evaluations are an hour, scheduled for an hour, so they're longer. And then the follow-ups are a half hour to 45 minutes, so they're not as long. So those go a little bit quicker, so we can kind of stack them up a little bit more.
Yeah, okay. Yeah. What is something that you would like your clients or prospective clients know when working with you?
Probably most importantly that I'll never lie to them. If they tell me I have limited dollars, can only do this or this. Well, if the thing that will most benefit their dog, the best bang for their buck, as I tell them, will not be me, I will tell them it's not me. And I take pride in that. I've always done that, whether it was private practice or now. because what's most important is the dog. I mean, they've got to get what they need. And unfortunately, the owners can't always afford everything they need. So you have to be able to focus on, okay, what's most important now? Maybe we can morph into something different later, but that's what I would try to send them away with. I will always tell you what I think, and I won't lie to you.
Very cool.
Yeah.
What are the typical results that you see with your patients? How long does it take for people to see results, or, or they apparent after the first treatment, or a cumulative effect? Like, when do you see?
That's a really good question, because a lot of things can take a little bit of time, and it varies. It depends on what you're talking about. So if you're talking about like pain control, then I may give something 2 or 3 visits, and if we're not seeing a difference, then I'll say, okay, we got to change it up. If it's something like strength, which takes longer, or nerve regeneration, which takes way longer, like for a brachial plexus problem that, after being hit by a car, then you have to really prepare. My favorite line in canine rehab, well, it was in human medicine too, is this is a marathon, not a sprint. You have to mentally prepare your patients. So it can vary from, you just had surgery, I'll give you, I'll see you today, I'll see you in a month, you'll be done, to, well, you know what, your dog got hit by a car, I can't use its limb. If you want to save the limb, this is going to take 4 months. So it just varies. It depends on the injury, the dog, and the owner's ability.
Okay.
Yeah.
And what would be an ideal patient for the work that you do?
Rather than give you diagnosis, ideal would be getting them early, regardless, whether it be surgical, non-surgical, sports injury, working dog. The sooner I can get my hands on them, the better, more effect I can have. But also, and this is so true in human medicine too, the people that do what you tell them, because it's kind of rare. Honestly, I mean, when I used to, my human patients, 35 years, they'd come back, they'd do all their exercises, they'd come in and be better, and I'd be like, you're better? You did them? Wow, that was 35 years. So, but everybody, the exercises require the human's input. So, but people that do what you tell them to do are going to have the best results.
Yeah, a compliant owner really is.
A compliant owner, thank you. Perfect description. Yeah.
Who would not be an ideal patient? Or in other words, are there patients for whom this treatment might not be suited?
Yeah, if this is why, as a physical therapist, I so rely on my veterinary relationships, because there's so many things that can mimic musculoskeletal problems. So if I have a patient who has a medical problem, I'm not going to be able to help them. Like I had one dog who came in for back pain and had kidney infection. Well, I can't fix a kidney infection. Yeah, because it was referring pain to the back. So, right. So, that needs a veterinarian or a specialist of some sort. A physical therapist isn't going to fix a kidney infection. But also dogs that are very painful and need to be managed, their pain needs to be managed. Those, I can't do that either. I can't do prescriptions. It's not within my wheelhouse. So you need to have that's where the working relationship for me, if I was a vet, it would be different. But since I'm not, I need that collaboration with my vets.
The partnership with the veterinarian.
Yeah. Absolutely. Yeah. And I love it. I enjoy that. I've always enjoyed it. Even in human medicine, I enjoy it. Yeah. And I do find vets to be way more collaborative than human doctors.
What is something that you would advise your clients that they can do at home with their pet to help them?
Okay, that's actually pretty easy. I'm the weight Nazi, so weight control is huge for me. Okay. Huge. I mean, there's so many downsides to having an overweight dog, and I don't care if they're an orthopedic dog, a neurological dog, a cancer dog. Being overweight longevity alone will be massively affected. So weight control is a big one. And literally, it's amazing what just plain walking your dog can do. You can change surfaces, you can change grades, you can use curbs as exercise. I mean, there's so many things you can do by just walking your dog. And consistency, that's the other thing. Whether it be diet or exercise, consistency, without it, you're not going to have any results.
And like you said, dogs don't lie. They'll let you know if they're losing weight or gaining weight. So they tell you the truth. So you can't even be your therapist, because guess what? Right. I have been walking, then how can you gain 3 pounds?
That's absolutely right. Yeah, no lying to a
He's
dog.
not going to lie to you. Oh, that's funny. And generally, how many treatments would you recommend? Obviously, it depends on
Again, yeah, it does. So really, the number of treatments is a function of the owners. Like, what I'll do is I'll give them, this is ideal, whether it be twice a week for 4 weeks or once a week for 2 months. And then you say to the client, okay, now what can you do, both schedule-wise and financially? Now, where I work now, we have this wonderful drop-off system. So somebody with a really bad schedule can come, we're a 24-hour service, so they can come in, drop the dog. I can treat them whenever I can, and they can pick them up whenever they can. But that's a huge, that has a huge effect on what people are able to do, and especially the financial piece. I will say that for sure. So then we have to make the two meld. We got to look at the goals, see what ideal is, see what realistic is, and then find a happy medium. So that could be 2 treatments. It could be 15 treatments, and it depends what your treatments are and what you're treating. So it sounds like a vague answer, but it really is vague.
Thanks. No.
Yeah. Sorry. That's as good as I got.
Okay. Tell us about a particularly rewarding patient experience. That are expected, something like that. Or I know that was one of the dogs in your clinic came in, he wasn't walking or something. You got him.
Oh, yeah.
I know you have a soft spot for those seniors too. So.
And I do, yeah. Actually, what comes to mind, the first thing that came to my mind is watching, if the owner can be in the room, when you're watching an owner watch their dog take the first steps after being paralyzed. Oh my God, they cry, I cry.
Yeah, it's
so emotional. But I had this one cockapoo, beautiful little cockapoo named Maggie. Her dad, they came in Christmas Eve, I got this hysterical call. They were driving home from the vet. They had just had surgery. The dog was completely paralyzed in the back. And mom was in tears. Anyway, the whole thing. So we got her in the next week. Well, Maggie's dad is a state trooper. He's like sergeant in the troop of the troopers or whatever. And if you ever know any state troopers, they're very macho. They're very stoic. They have necks like tree trunks. They're just very...
They're prepared.
Yes.
They're prepared.
This man, I am not kidding. He sat on the floor. He looked me dead in the eye, and he was crying. And he goes, "You have to understand. You have my heart in your hands." Oh my God! He just ripped my heart out of my chest, pal. That's all you got to do, right? Oh, so anyway, the first time Maggie walked in the clinic, and she got all the way back. Which was a good surgery followed by quick follow-up. It wasn't just me, but really she would tear around, and that comes to mind as much as anything. But she's like an example of one of those dogs where it's the best outcome you could hope for.
Yeah. You're right. They just know to get better. We're the emotional wrecks.
Exactly. Yes. And they don't care if their legs don't work.
There's something wrong here. Let me fix this. And the body goes to work. And meanwhile, we're like,
Yeah. It's true. It's true. I'm being joined by company. Hello.
Oh, hey.
Benny.
Benny.
Yes, this is Benny. Yeah. Hi, Ben. Okay, you can
Can you face the camera for a little smile, perhaps?
Can you hear? Can you face the camera? I told you he was the devil. I don't know if you
adorable. He's perfect.
All right, goofball. Yes, I know. I love you too. Okay.
Enjoy us. That's fine.
Yeah. Sorry. Little intermission.
So cute. Devil, little angel right now. He's telling everybody that you're a stinking liar out there, that he's the actual angel and not the devil, right? Lucifer.
That's right.
Now, does your work pairs well? How well does it pair with rehabilitation and integrative treatments?
Oh, great. Acupuncture, I have a great relationship with an acupuncturist here in town. We refer back and forth all the time. Chiropractic is another advantageous adjunct. I can do some, physical therapists call them mobilizations. I can get some alignments back. There are certain ones that just require a little bit more oomph that I don't have that I'll send to a chiropractor. And like I said, being a PT, any vet, any referring vet that knows the client, to me is a collaborative effort, because there are certain things I just can't do. Right. But anyway, but I would say probably the service I use the most is acupuncture
Interesting. Okay.
as an adjunct. Yeah.
Oh, nice. Okay.
Yeah.
And how has the COVID, this pandemic, changed the way you treat or you work with
You know, it's interesting because prior to COVID, the clients were always sitting there in the room, which I love because they can give me feedback. But what I learned, so when COVID hit and all of a sudden they weren't allowed in the building anymore, which most practices are still doing. I was really worried, but let me tell you something. Dogs behave. They're like kids. They behave so much better when their owners aren't there. It's like, I'm like, holy crap, these dogs are so good. It's amazing.
Boy, yeah.
It's amazing. So I'm a little worried about the owners coming back in the building, but I mean, it obviously has its downsides. But these dogs are so blooming good. They're wonderful. They're wonderful. Yeah. I'm a little scared, but I'm not sure that would change if the owner was there or not.
Right. Oh, sure.
Yeah.
But you know, like when I take mine to the vet, of course, I bring my fear and my anxiety. So,
oh, absolutely.
Even, you know, and they're going for a ride. Let's go for a walk. And all of a sudden, it's like,
yes. Yeah. What have you done?
Sometimes you take them, you know, out of the car and let them sniff around. Oh my God, this is like a dog park. There's so many scents, you know. And all of a sudden, somebody opens the door and you get that waft of vet, you know, and you're like, the dog just put up like the stoppers.
Absolutely.
Yeah. And then of course we feel their anxiety. Yeah, and you guys are even, you know, objective and positive and all that. I'm sure the dogs, oh well, maybe this is not so bad. So
exactly. Yeah, because we're all relaxed. We do this every day, so to us it's no big deal. You know,
you know, it's traumatic.
Yes,
I can't believe I have to take him. It's awful. He's gonna know. But anyway, so lastly, what is something you would like people to know about you and your work?
Like probably most importantly, just that I will always do my best to meet the dog's needs and the owner's needs. So make sure that we coordinate, you know, whatever's best for the dog is what I'm all about, because, you know, I liked human medicine. I wanted to be good at it. Honestly, I hate to admit it, after 35 years, I was never real passionate about it. These dogs are like what I was put on this earth to do. As far as I'm concerned, this is it, you know? So as long as the dog's getting what it needs, I don't really care. They will always get a straight scoop from me. That's pretty much, you know, yeah. And I enjoy I enjoy the variety. I enjoy putting all the pieces together. And it's actually when a client can't talk to you, you have to be much better at all the other stuff, you know, to figure out what exactly is going on. So yeah, it's, but to me, that's fun. I love that part. Yeah.
That's great.
Yeah.
And I just want to add before we finish up that you were also an instructor at Star Conference several years in a row. So we were very, very pleased about that one. You look a little feather in our cap too. So I forgot to mention that in the beginning.
Oh, shucks.
Stop it. But thank you so much.
There's no better conference out there. It's fabulous. Star's wonderful. No, it is. It really is. As good as it gets.
That's because you're there. Oh, let's, you know, we're gonna, like,
yeah, it's getting kind of, I'm up in here, girl.
Sorry about that, but we had to like pat each other there.
That's right.
Yeah, that's right. Jeannie, thank you so much for joining us today. We really appreciate it, and we look forward to having you as a teleconsultant and a future STAR conference instructor, and of course, just one of the greatest people I've ever met in the history of ever on this planet. So thank you.
Ditto.
I don't know about that.
Oh, I do. All right.
Thank you, Jeannie.
You're very welcome. Thank you.